Well, good morning, everyone. Welcome to the 13th Nuffield Trust Summit. It's our first online. So many of you will probably not have been to previous events we've done. We've inherited the name Summit, but it's really a collection of interesting people with different perspectives who come together to just take a step back from policy. And I hope that you'll find this in the next 3 weeks a valuable experience. We're keeping the sessions short. Some of you may also be familiar with the Nuffield Trust. We're a health policy and health services research think tank. We look at a wide range of issues from healthcare delivery through to healthcare policy and indeed social care. And this is an opportunity, as I say, to sit back and reflect on some of the bigger issues of today. After this session, next week, we've got a further public discussion taking place tomorrow. Next Tuesday and Wednesday. The full programme is available on the platform and you can sign up at any point during the series. This week we're looking at the role of evidence and science in policymaking with some great speakers. Joining me today, Dame Una O'Brien, who's previously Permanent Secretary at the Department of Health, and Professor Martin McKee from the London School of Hygiene and Tropical Medicine. And tomorrow we have Jeremy Hunt, Ashish Shah, now at Brown, previously at Harvard, and Alexandra Freeman from the Winton Centre, David Spiegelhalter's outfit at Cambridge. Next week, we're looking at the pandemic as a catalyst for change and looking at some of the big tensions in our healthcare system in the UK. And we're going to be hearing from Abigail Woods, and that will be followed by 2 panel sessions. We're really grateful to everyone involved in making these events happen. Our sponsors, MSD and Optum, our media partner, BMJ, our Nuffield Trust events team, who've adapted to a whole new way of working, and the team at Glasgow's who are working behind the scenes on this platform to make it work. Each session is about an hour long. It's live streamed. You can watch it again on demand if you feel so moved. We encourage you to use the Q&A box on your screens to send us questions as we go along. My Nuffield colleagues will moderate those. Today, questions and comments are going to be moderated by Leonora Merry, who's our Director of Communications, and she will pop up from time to time to give us feedback. So we're rather reliant on you doing that. Please do use that Q&A box. And at the end of this, we'll send you a link so that we can we can evaluate it. If you feel able to watch and tweet, if you've got that level of multitasking, then please use the hashtag Nuffield NT Summit. So that's NT Summit. So today we were going to look at the role of science in policymaking, and I guess it's never been more important, or indeed more visible. The government said they were following the science, but it's probable that this really oversimplifies the role of science in political decision making, and it's been a bit undermined by the pattern of doing the right thing only after all the other options have apparently been exhausted, to paraphrase Winston Churchill. IHG have been pretty critical about this. IFG, the Institute for Government, they think that the government's really failed to bring in different strands of science advice together, in particular behavioural science, and so really failed to create a coherent strategy, especially back in May when experts don't seem to have been consulted about the Eat Out to Help Out scheme. And SAGE was consulted quite late in terms of giving sensible advice about the return to universities. Other criticisms include missing disciplines and not enough emphasis on practical public health measures, in particular the lack of learning from Asian countries that have done pretty well, particularly around track and trace. Track and trace has taught me a new phrase, which is goat rodeo. Go and look it up. It means complete chaos. It maybe is a bit unfair, but it's certainly going to be the most difficult part of any public inquiry. While we've had the parliamentary committee looking at government scientific advice at the sort of moderate end, and the Institute for Government in the middle, at the more extremely critical end is Cameron Abbasi of the British Medical Journal. As I say, our media partner is much more sceptical about government's claims, and he believes that science has been suppressed for political and financial gain, and is pretty scathing about the lack of transparency about SAGE, at least in its initial phase, about the attempt to suppress reports on the impact of COVID on inequalities, and in particular on BAME people. He feels that PHE have attempted to block the journal from publishing on this. The number 10 has got in the way of publication about the poor performance of some of the point of care tests, and he's really very strongly believing that the politicization of science, which has happened, is sort of equivalent to what we've seen in some other more autocratic regimes. This is kind of surprising, I have to say, because I've always found Cameron and the BMJ to be extremely measured and very thoughtful. So I think you really have to take that line seriously. We'll come back to that judgment and see where we are on that continuum. But first, we probably ought to take a bit of a longer view first. And I'm going to come to Una and get you to perhaps look back on your experience and think about let's be appreciative and start in a positive place and say what's really worked well in the way that governments and civil servants have used evidence and expert opinion in your view.
Yeah, well, good morning, Nigel and Martin, and hello to everyone who's listening. And it's great to be part of this conversation this morning. Well, this is an immensely complicated subject, so it's important that we don't, if you like, get into too much of the detail because we get lost in it. But I wanted to just sort of bring to the conversation this morning some wider appreciation of what's going on in real time when ministers are working through their decision making, because although certainly in health, scientific advice and evidence is really important, it's not the only consideration, and that's clear in peacetime as well as in pandemic time. There are economic considerations, there are issues about public acceptability, there are even, believe it or not, questions of ideology and political stance that come to bear when weighing up around decision making. So although we'll come back to the great push there's been in the last 20 or 25 years to get evidence informed policy, that evidence is wide ranging and includes science, but is not exclusively limited to it. Some examples where I think a combination of evidence has come to bear and had big impact on important decisions and policy initiatives I've been thinking about. I mean, one in particular that strikes me is the introduction of improving access to psychological therapies, which if we actually went back to the early 2000s, this was regarded as a real difficult step to take to introduce these sorts of therapies on a wide scale across the whole of the NHS. And a combination of the evidence about what works on cognitive behavioural therapy and easier access to psychological therapy to help people with anxieties and mild depression has gradually built up over time to the extent now that this is a mainstream policy and practical initiative in the NHS. And I think that's it's a really good example for me of how science and practice has come together to back the spending on a significant new service. Another one I think has been really important to the introduction of family nurse partnerships, where we relied quite extensively on evidence from how this policy played out in the United States. But there are some, and this is perhaps my third example, and I know Martin will have a lot more experience of this policy area perhaps than I have, and that's the whole vexed issue of the time it's taken to get tobacco and tobacco products under control. In my final years at the Department of Health, we were dealing with issues such as concealed cigarettes at point of sale and plain packaging. And the evidence was mounting very strongly in favour of acting on both of these. Indeed, we even had regulations, I think, before 2010. But the difficulties in actually going ahead with that were political, but also practical concerns about legal action internationally and the consequences of that for the success of the policy. Things that were outside the domain of the Department of Health to influence had to be weighed in the balance. So I think the main point I would say at the outset is scientific evidence and the very best of it, peer reviews, systematic reviews, are taken really seriously in the Department of Health and much sought after where they exist. But it's not the only evidence that's used to make decisions about important health measures.
Thank you, Martin. What's your perspective on this? Because you also, I think, give advice to other governments as well. So you've perhaps we'll come on to some international comparisons later, but give us your broad feelings on this.
I'll rephrase that sentence. I also give advice to other governments elsewhere. I know also I don't actually give any advice to the UK government. It's at least a decade since anyone's asked me for any advice. I'd like to pick up on Una's points, and I totally agree. We've just had a paper accepted looking at the IAPT programme where we used the differential rollout in Oxfordshire and Berkshire and Wiltshire, and it shows this has really worked very well, and particularly we were looking at it for those people with other morbidities, so that's a great example. And I also would maybe pick up on the tobacco point as well, because at the time we did actually undertake a systematic review of legal cases where the tobacco industry had been engaged, and this was almost always on constitutional law, as well as looking at the trade tribunal, which was not litigation as such. And we actually showed that the tobacco industry always lost. So we always felt it was a bit unfortunate that our paper wasn't taken up, because it was written with colleagues who were lawyers to really address that. So my experiences are, as you say, Nigel, very much outside the UK. And I think there are lots, some of which you've been involved in. You might go back to the work when the Norwegian government was reforming its hospital structure many years ago, after a book that we published, I think, in about 1992, bringing it right up to date. I've been heavily involved in the discussions on the proposed reforms to the health system organization in Finland. And as you know, a lot of work advising the WHO regional office in Europe, which you've also been involved in. I think we've, in the observatory, we've been particularly able to exert an influence, or to have an influence, through the rotating EU presidencies. Interestingly enough, we've prepared material and fed into virtually all of the EU presidencies over about 2.5 decades, with the singular exception of the UK's one. But leaving that aside, I think work on making the case that investment in health was important for economic growth, not just in low-income countries, but in high-income countries, acting through greater productivity, greater labour force participation, investment, people investing in education because they had more to look forward to, people investing in their businesses again for the same reason, and that fed into the health is wealth argument. Also into a whole series of cancer conclusions, a council conclusion, European Council conclusions, for example, cancer with the Slovenian presidency, and a lot of work on the cross-border care directive, which at that time, actually, the UK really played an important role. And Nick Boyd, who was then leading the international office at the Department of Health, was really well plugged in. And that was a time whenever there were informal, well, there still are lots of informal meetings before council meetings. And Nick and his colleagues, particularly in Germany, because of course he had a strong connection, family connection with Germany. I remember us all going off to a huddle in Celle in Germany to sort of pre-plan the discussion. And I think that demonstrated the ways in which we could have an impact. But what worked? Okay, well, how were we able to do that? I think working with people who have a genuine openness to other ideas and to learning from elsewhere. And I think that we do have a problem with that in the UK. Other people from other countries read the BMJ. I remember once being at a meeting in Washington where a Secretary of State in the UK at the time made a statement which was frankly fanciful. And the then New Zealand health minister came up to me at the coffee break and said, do they not realize we read the BMJ? We know what's going on. And we don't seem to have that same degree of awareness of elsewhere. Our willingness to learn, except for from the United States, and sometimes I think learning the wrong answers. And I think maybe the Harkness Fellowships have something to do with that, but I think they have many benefits too. Clearly trusted relationships over time. The fact that ministers have your mobile phone number and can call you. And sometimes they're asking for really trivial things. They just want a particular fact, or they want some data or something like that. And that realization that you will respond on a Sunday evening and give them something quickly, that really builds that trusted relationship. You need subject knowledge. You need to know what you're talking about.
So let me pick up this subject knowledge matter issue, Martin. I think it is really important. I mean, one of the things, Una, I think when we were talking in preparation for this, we were reflecting on was that if we think back sort of 10, 15 years ago, cancer, cardiac services, intensive care, there would be mental health, there would be a subject matter expert in the Department of Health who had a pretty deep knowledge of the area, probably was pretty well networked to experts in academia and in practice as well. And you could ring them up and say, what's the state of play on this issue? And they'd be able to answer. My impression is those people have sort of gone. So sort of people that Martin is referring to there, who one would sort of be able to interface and discuss one's evidence. Has that been an issue? I mean, has there been something about the civil service having a bit of a shift away from the specialism towards a more generalist model, do you think?
Yeah, well, I think this definitely goes in cycles, and I recognise that point that Martin's making about the sort of informal networks that people build up, as well as, the more high-end systematic evidence and science that we're also talking about. If I go back to 30 years ago when I first went to the Department of Health, it was full of civil servants who knew their subject inside out, and they were almost desk officers for the subject. And whether there was a lot to do or not very much to do really didn't matter. The fact is that you had someone who knew an immense amount about one of those health topics. And I think over the years, because of the introduction of technology, obviously, but also changing views about how the civil service should operate, that model has largely gone completely. If we come to the early sort of turn of the century, there's a much greater emphasis on leadership and management, building up to a considerable degree of openness to reaching out for policy input from think tanks like yourself. I mean, I know the Nuffield Trust has been involved in a number of really important policy initiatives in the department, as have the King's Fund, as has the Health Foundation, and reaching out also to academia. So the sense in which that the civil servants in the Department of Health no longer needed to know everything about everything to do with health, could reach out into this wider network. But what's probably been lost in that process, and I'll reference a couple of important initiatives to try and readdress the balance. What's been lost in the process, in my view, is a sufficient capability to make sense of the real world data of what's happening in health, and to make sense of the science and other expert evidence. Because if you don't understand the issues about health and the delivery of healthcare in a complex system, it's very difficult when you're there yourself advising ministers to be able to calibrate and to weigh that evidence. Now, I think that has been recognised as a problem, and there are some really good things that are going on. For example, unusually in the civil service, the Department of Health now has its own graduate fast track entry, actually encouraging people who want to specialise in health policy. We work very closely with Imperial on a master's in health policy, which includes policy theory, economics, and public health. These are steps in the right direction. I still think there's a counterweight in the civil service that thinks, oh, a generalist can move around and be good at, education, fine, health, justice, it's all, if you're just smart, you can deal with anything. And that's something I think isn't really good enough for health, and does need to be constantly what we need vigilance. We need capable people who are deeply knowledgeable about the health system to be able to have a good career within the Department of Health.
Mm. Yeah, I mean, I think the other bit of that you didn't mention, which was quite striking, particularly during the sort of 2000s and early 10s, was the outsourcing to consultancy as well, with relatively little knowledge transfer, which I think...
Yeah. It's a deep issue across the whole of the civil service. You know, the willingness to pay huge fees to management consultants and not to invest in, you know, let's face it, a really decent pay structure, particularly for the senior civil service. And I don't think that is specific to health. I think it's an issue across the whole of the civil service, which is a systems design issue about how much we're prepared to pay civil servants versus willingness to use management consultants, because the work has to be done, the expertise has to be accessed. You know, I think there is a recognition now, particularly from Michael Gove, that building better, stronger capability and subject knowledge, he has actually spoken about this in his speech on the civil service, should now be a priority for the next phase of reform.
What's the situation like in other European ministries that you deal with, Martin? Is this a common theme, or is this a particularly British? Is it the same attitude that said, you know, 4 years of classics and 6 months of India equips you to run a bit of India the size of Ireland, sort of, or do we share this with other countries?
Well, it's impossible to generalize because, of course, we're talking about 192 other countries in the UN system. But in general, there are many governments where I see much greater subject expertise actually right across Europe. I was going to say particularly the Nordic countries, but also Italy. Spain, maybe a bit less more recently, but had a long tradition of that in the past. And France and Germany and Austria, again, the things change, they go up and down because, of course, parties change. And some of these posts are individuals do tend to be seen as being linked to parties from time to time. That's what happened in Spain. It was problematic when the PP came to power quite a few years ago, when a lot of public health people had been linked to the Socialist Party. But generally, I think there's a very high level of subject matter expertise, both within the ministries and actually in some countries, some of the smaller countries do it really well. Malta, Slovenia, Estonia, for example. So I think they have generally got it better, but of course, not everywhere has.
Yeah, I want to come back to a point that you made very briefly, and it's policy issues where there seems to be some form of sort of allergic reaction by the politicians, or where ideology starts to impinge on the science. And I think there's some suggestion that our lateness to lockdown and willingness to sacrifice Christmas has some ideological underpinning to it. I remember Mrs. Thatcher vetoed a large survey of sexual behaviour and had to be bullied into an advertising campaign for HIV, which was probably less libertarianism and more Methodism. But I just wondered whether there are have we seen elements of that? Have we seen that in other bits of policy, and how does that get dealt with? Because it does seem like a particularly tricky issue, and it has tripped us up during this this issue, I think. So who'd like to go at that? Martin, do you want to have a go, and then we'll come to you.
Yeah, I think it's more complicated than that. I think we obviously need an inquiry, and as you know, Sarah Wollaston and Mike Gill and I called for a quick, rapid fact-finding, so that we could learn lessons from at the early, in about July, just so that we didn't make the same mistakes again. I think that there is a sort of underpinning libertarian ideology, but I think that has changed. And my sense, and Una may have a better insight into it than I do, because I don't claim to have any links within the UK, but my sense is that the Prime Minister is definitely now much, much more cautious than he was before. Perhaps his illness, but also perhaps the feeling that politically they can't afford to have yet another wave. So I think things have changed. There are clearly tensions between number 10 and number 11, but that's always been the case. We do know the Warwick work showed very clearly that the help out to eat out cases, policy was clearly linked to the rise in cases that we saw in the autumn. There's now very good evidence of that. And there still is that, as I say, that tension. But I think it's a combination. I mean, I think ideological and maybe not so much ideological, but just sort of values of the importance of liberty and so on do play some role. But I think there are a lot of other things going on. I think at the beginning, the problem was, frankly, the Prime Minister was not paying attention. He missed the COBRA meetings. He had his own personal challenges to sort out. He was getting Brexit done. And, we were late doing things. Most estimates, we've done work, others have done work, suggesting that even closing down a week earlier would probably have saved about half of the lives that were lost in that first wave. And I think probably, and I wasn't in the room where it happened, but I think that probably it was difficult to get attention to these issues at the time. Yeah.
So we'll come back and look at the details of how scientific advice was taken up and used a little later. Una, what's your taking a sort of long view on that as well? Yeah. What's your feelings on that?
Well, long before I became a civil servant, I wanted to be a politician, and so I really came into working in policy work from having been an active party member and thinking, politics was my future. So it might not be so strange then to hear me sort of defend politics as a necessary component in the world of decision making on public policy, because we live in a democracy. We elect our politicians. I'm saying only what most people on this call know, and we choose. As Martin has said, people who represent a set of values, a certain way of looking at the world, a certain emphasis on political choices. So in the big picture, I don't think we should be surprised that orientation is brought to bear on weighing evidence. Indeed, what's the alternative? It's deeply unpalatable. So for me, the issue is really something that we don't talk about enough, which is how can we support people and enable people who choose to go into public life through politics to be the best they can be at that work, and to themselves to understand the role that ideology plays alongside knowledge, expertise, evaluation, and other sources of information that are used for making decisions. So that's my first point. That's a longer point for the future. And obviously we've got some politicians who are much, much better at this than others. And the second thing is that I've become, ever since I left government, an even stronger proponent of transparency. And I think there should be, both in relation to the pandemic, of course, we'll come back to that, but more generally, a much more rigorous requirement on publication of the factors that weigh behind decisions, so that everybody who's played a part and the part that politics has played can be held to account. And I think that we've sort of lost the plot a little bit on that, and we need to really return to and refresh our campaign for greater transparency and for better freedom of information.
I very much agree with that. One book that I find very illuminating, I should say that my daughter is a political scientist, so she feeds me these things. It was Isabel Hardman's book, Why Do We Get the Wrong Politicians? And reading that, you wonder why anybody goes into politics, to be perfectly honest, in this country. It's a rotten job. It's very difficult to get yourself on the list and then to get elected. And then when you get there, often you're doing something, you're doing many of the things that when we stand back and say, well, why are you doing that? And So, for example, I think many of the things that should be done by councillors in local government then get taken over by MPs in their surgeries because they need to be responding to their constituents' concerns. And, you know, that's fine, but it's actually diverting them from the process of legislating. I think we also have a problem in this country of a confusion between the roles of the executive, the legislature, and the executive often, and it's not helped by the situation we have. I think that somebody at some stage should really step back and look at our constitutional settlement, because I'm not sure it's working. And, you know, we know the book, you know, Ivor Crewe and Anthony King, The Blunders of Our Governments, and some of the reasons behind that. So I think
that's going to need some updating.
Yeah, well, indeed. But I think it's important for those of us who are giving health advice, not only to read political biography, and behind me I've got a lot of political biographies, but also to read from political science to understand the challenges that are being faced, because decision making is really difficult. And particularly when you're being diverted by all sorts of other things that you really shouldn't be doing. Legislating, to my mind, and holding the executive to account should be a full-time job. And I don't think it is at the minute.
Yeah, whole bunch of things in there to unpack. We'll perhaps come back to the question of how you prepare people for government, both in the civil service and politicians later, perhaps. But I wonder whether this raises some other interesting questions about whether there are actually genuine differences in the way that what those of us who produce evidence tend to think is fairly clear-cut and speaks for itself. And actually it's interpreted quite differently by the end users. They make different decisions when they consume it. We tend to think that we've produced our beautiful report, but actually how it's read and interpreted. Is that something, either of you, that you've come across? And is there an issue that we need to be thinking about there?
Well, how shall I say? I think one of the important things if we're just talking about science for a moment, is there is still, amazingly, after all these centuries, still quite a mechanistic view. And we saw some of this time last year. There's this thing called science, which we take and we follow it. But actually, the nature of science is that it is tentative, it is uncertain, it is emergent, it is weighing up of different risks, and it is a sort of continuous exploration. And the difficulty that policymakers have in the public domain of articulating uncertainty and emergence of evidence. I mean, we've seen, you know, that throughout this year, and it's very uncomfortable for politicians and to be able to do that. So one of the things that I think is going to be incredibly interesting is the way this experience, the enormity of it, starts to influence the way we think about science and evidence in policy in the future. Because I think something underneath will have shifted, this movement we've now seen to be able to talk to the public from politicians much more confidently about uncertainty. That's the shift that I think that we've seen in the last few months. And I'm really going to be interested to see how that plays out when it comes to other policy areas in health in the future.
Great. Martin, any quick...
yeah, totally agree. But it's not helped by the media, which then treat any change of opinion or change of policy as being some sort of a gap, or, you know, why were they wrong then? Well, because the evidence has changed. That famous quote from Keynes, that when the facts change, I change my mind, what do you do? But I think there's another area that's really important. I teach in one of my courses a module on communication and the role of cognitive biases. I mean, we know that the way in which people interpret information varies in all sorts of ways. My favorite examples are a study looking at the time since the last cup of coffee and sentencing decisions in Israeli courts, or another study from Louisiana which showed that the success or otherwise of the local football team had an impact on sentencing. There's a lot of literature from the legal research on this. But, you know, I sometimes joke that it's almost as if talking to some politicians, they've got, if you recall Douglas Adams in The Hitchhiker's Guide to the Galaxy, the Babel fish that people put in their ear and it would translate every language in the galaxy into one they understood. But it's as if they've got a dysfunctional one where you say black and they hear white. And we know that is the case. The World Bank did a very good study in 2015, the World Development Report. It looked at all of the classic studies, psychological studies of decision making with data. You know, for example, looking at whether numeracy or previously held views was more predictive of whether people would get the right answer when it was, and the study, an original study asked people about either gun control where people had strongly held views or skin cream where nobody cared, frankly. And with the gun control, it was their previous views that determined the answer, whereas with the other, it was their numeracy. And, you know, they did the same with poverty in the bank and got the same results. So we really need to understand much more about cognitive biases, of groupthink, of anchoring. And there's a whole litany of these, which we've
certainly confirmation bias.
Confirmation bias.
That's been a great comfort to me over the years, I have to say. Leonora, what have you got from the 140 odd people we got on the call?
Yeah, thanks, Nigel. So we've had quite a few questions in. I'm going to kind of pull a few together. So some general ones on the kind of the overall picture on the role of evidence. So Alistair Henderson from the Academy of Medical Royal Colleges asks, is there not a balance between the benefits of relying on civil servants with subject expertise and genuine engagement with a range of outside experts, for example, think tanks, academics and professional bodies? And I'll just put a couple more and you can sort of pick and choose your responses. Joe Farrington Douglas from the Health Foundation says one of the benefits of the pandemic has been the higher profile of scientific experts in the media, and that has increased public trust and adherence to public health guidance. So is that grounds for building on, or do you think politicians will claim back control? And a very quick one from Diane Peacock, who's a retired academic, asks, how can we avoid short-termism in policy making? So I'm going to turn my camera off and come back to you later. Okay.
Good ones. Thank you. I'll invite you to pick and choose, as Leonora says. Three really interesting questions there.
Yeah. Well, let me just pick up a couple of threads on that. If we're thinking about the Department of Health today and into the future, I think it has to be an open organisation. And my experience of working there and my observation in recent times is that it is. You know, it very much reaches out to charities, to think tanks, to experts in the NHS, maybe not as much internationally as it could do. I do think Martin's got a very strong point there. But the enormity of health, a lifetime isn't long enough to know all that you could know about it, all that needs to be known to support ministers. So of course it's got to be open. But I think the point that I'm also making is that the capability and expertise within the organisation has to be such that it knows how to make intelligent use of that knowledge, and also knows the terrain, the network to reach out to. So actually I think we need a combination of the two. And I would like to see a lot more secondments into the department of people, you know, from think tanks, from charities, and from the NHS, so that we can get that greater enrichment of understanding what causes problems and what can be done to solve them.
I know Martin's slightly critical of us always looking at the US, but one of the things that is noticeable there is a much more permeable layer, a permeable membrane between academia and the civil service. So people will get secondments from academic posts into the civil service, which does seem to bring some benefits. Sorry, Una, I think you were going to...
Yeah, well, I think that there is some small experiments going on in that very area across government at the moment. And of course, the Department of Health does have at least two contracts with universities, Exeter, and then a combination of the London School of Hygiene in UCL, where they can refer problems to academics to get input in real time. And those two contracts are very, very important to add to the commissioned work and research on particular topics. Short-termism, long-termism, this is a real issue. I think we've had some breakthroughs recently on the sort of 10-year way of planning for the NHS, although that's coming under a bit of challenge at the moment. I think we need much more longer term thinking. I can remember being Director General for Strategy in the department back in 2007, 2008. And I think we fairly accurately predicted the trajectory of obesity, but mobilising action to do something about it when it hadn't presented at the scale of the problem that it now is was extremely difficult. So the point about long-termism is you have to be prepared to take action before the problem turns up on your doorstep. And that is quite difficult for governments to do.
Martin, you want to pick up that, and perhaps a question about the higher profile of scientific experts?
Well, on the issue of long-termism, I think this is not a problem for the health sector as such. It's a much bigger problem, and we'll all recall when Will Hutton wrote The State We're In, what is over a decade ago, I'm sure, and made the point about how, in a way, I mean, there is a particular problem in the UK, which is the power of the executive. You know, in the old days, we always learnt from New Zealand because they had a single chamber, they had no written constitution, they had a lot of things like us, but then they introduced proportional representation, which then diminished the power of the executive to some extent, and they didn't have this constant, you know, a minister would wake up in the morning and would have an idea and it would be transposed into law by the afternoon almost, I joke, but we have had some examples of that. And I think that does not help. And I think particularly the system that Hutton was looking at in the more continental system of working with the social partners. Now, you maybe don't want to go all the way that the Netherlands does, where it seems like there's endless discussion that goes on for years and years and years, the Decker proposals and things like that. But I think I think this comes down to the power of the executive to do things without proper scrutiny. And I would argue that we do not have proper parliamentary scrutiny in this country. And I think that as a result, we do get some of these short-termism. The role of scientists, yeah, I mean, I think it's been not always edifying because, of course, there are, you know, we're seeing all sorts of problems with the way in which people are interpreting the evidence and differing views. And some individuals, I won't name names, but I'm sure you can guess who they are, who were promoting certain ideas early on in the pandemic, people at very prestigious universities, which were clearly, to many of us, nonsense at the time and have proven to be nonsense later. And I think that's been quite unhelpful. So I think we in science need to look at ourselves and all of that, and how that was handled. And there was one other question that I just seem to have lost, but I can't remember what it is now.
Well, we've done short term. It was. Oh, I've lost it too. It's disappeared.
They've all gone. Anyway.
Yeah. Okay. So, Leonora, are you there to remind us?
Yeah, so
it's disappeared from my thing here. I
think you've given good answers to those, and I can bring in some other ones if you like, which are
yes, go on.
Why not? Yeah,
and then I think we'll wrap up with a sort of quick post-mortem on not quite post-mortem, but a quick assessment of where we are with science in the pandemic. Because Martin's given us a bit of a view on that already, but we should just come back and wrap up with that. So yeah, should we pick up a couple of others?
Yeah, so there's another one from Joe Farrington Douglas from the Health Foundation, quite a specific one, which actually, Nigel, it might be good to get your thoughts on as well, if we can. What do you think that will be the impact of on evidence-based policy of giving the Secretary of State a more direct role to intervene in hospital reconfigurations? So that's obviously referring to the white paper, which is currently under consideration. Nick Black, it's not really a question, but it's sort of an interesting area to highlight.
And a blatant plug for an excellent lecture this afternoon.
Exactly, which I think I've released so everyone can see the link there, which is talking about the evidence that's required to understand when face-to-face consultations are needed as we come out of this pandemic. And there's one that's just come in from Kit Byett, who's a retired consultant geriatrician, who says, is it politicians, the public, or the media who need better education about how to consider complex issues?
Yeah. Well, shall I have a go at the first one of those about Secretary of State? I mean, Martin made the observation that waking up with a good idea has generally been quite hazardous. I mean, you mentioned the DECA reforms, and while they've in the Netherlands, and while they've mutated over time, there's been a kind of amazing continuity in Dutch healthcare reform that I suspect that is a significant factor of why it's been successful, and it's been much more insulated from the whims and ideas of politicians, not least in the Dutch system, because the Minister of Health and I think sport as well generally is somewhat arm's length from the NHS. I mean, I think the short-term culture, and you didn't blame the Treasury, but I have a strong suspicion that they're lurking in there as part of the reasons for this, but also our particular media and the way our politics works and the nature of the first past the post political system means that perhaps a controversial thing, but probably one of the few things in the Landsea reform that I think probably was quite a good idea was providing a little bit of distance between the Secretary of State and ministers and the day-to-day workings of the NHS. And we certainly saw, during the Blair period, what the risks are of having a activist Secretary of State with their own views on how policy works, which may be actually quite different and orthogonal to those of the person who preceded them. So you're getting quite big lurches in policy, almost the opposite of the Dutch example that Martin was talking about there. Una or Martin, what are your views on those other those interesting issues, the media, politicians, and the public about education?
Well, I think that we all need to learn more about what science means in the modern age. It's moved on immeasurably in the way that it's taught in schools, but we've still got a whole swathe of us, myself included, in the adult population who've got particular paradigms about what scientific endeavour is actually about and what it can realistically achieve. So I think people who are doing good work in this area, that is being immeasurably helpful. David Spiegelhalter, for example, and the immense contribution he's made over the last year in helping the whole country re-understand statistics, that subject we all hated at school. He's done. We just really need to encourage more and more young scientists to be able to communicate what they do and how they do it and how it can influence public policy. And there are various initiatives on the communication of science, but I think there's really scope for a lot more. I did just want to say, just looping back to a previous question, that if you look at 4 really big problems we're facing in health inequalities, obesity, growing antimicrobial resistance, and social care, all 4 of those problems are very complex to solve, need a long-term view, and they all remain unaddressed in any significant form. And I think that is the nature of the next big challenge in health, is how can we build some sort of cross-party consensus to address these problems that bridges the political divide and general elections, because otherwise we're just going to be going around in circles and not dealing with them in any way that's effective.
Nick Black makes an interesting point in relation to that about whether we think that increased deliberative democracy would be helpful there. Martin, do you have
I declare an interest. My daughter was one of the lead researchers on the Citizens' Assemblies on Brexit, climate change and social care. Okay. So Rebecca would definitely agree with that. And I'd like to agree with Una. I mean, I think the long time scale just last night, we're working on a paper which hopefully will inform the G7 process on antimicrobial resistance, which has in it a scheme for a 10-year time frame. So these are long-term challenges. I think Joe Farrington Douglas's point about the Secretary of State's role in hospital configuration, again, I think that comes back to my point about the role of the executive. We have just had several developments in this country. The Secretary of State for Health was found to have acted unlawfully on the publication of procurement contracts. The Chancellor of the Exchequer has just announced the allocations to a Towns and Levelling Up Fund, where the funding goes to meant to be going to some of the most disadvantaged areas in the country. 39 of the 45 have members of Parliament from his own party. I think this is problematic in terms of actually, just does it look right? I think there's a real question here about giving the executive more power against a background like that, where there are genuine concerns. In terms of getting a higher degree of literacy in science, I would just have one plea. I just wish that we would train more people in understanding the nature of exponential growth and exponential decline, because I think, the Financial Times has been great at explaining this, James Burns Murdoch and others looking at the data. But the reality of it is that this is a virus that is either going to increase slowly at first and then more rapidly, or it's going to go down. And we haven't factored that in. And what is most surprising is that the Treasury or the Chancellor seems to be the least aware of this, even though it is exactly the same phenomenon as applies with compound interest. So you would think that, they would know that. And so I think that fundamental mathematical principle, if we could get that across, that would be really, really good, leaving aside all of the other things that obviously we would love people to understand. And just on that, maybe I just say a lovely study from the United States in the Proceedings of the National Academy of Science, where it used a survey, and it included a test as to whether people understood exponential growth. And those who did not understand it were much less likely to support restrictions. Also, those who did not understand it were also much more likely to be Trump supporters.
Interesting. Yeah, okay. I wonder which way the causation runs.
Yeah, well, indeed.
Good. Okay. So going back to my continuum of the Select Committee, which looked at the use of science and at one end of the continuum, and Cameron Abbasi on the BMJ on the other, and the Institute for Government somewhere in the middle, which talks about both problems with the transparency of science, the use that's made of it, the failure to understand that there are trade-offs, and in Cameron's case, actually a view that it's been to some extent corrupted. Martin, where do you sit on that? You're part of Independent Sage, and it might be worth just saying a little bit about the background to that.
Well, it arose when Sir David King was concerned about the transparency of the membership of SAGE and a feeling that we weren't bringing together all of the disciplines. So it is much more multidisciplinary than the formal SAGE. To be perfectly honest, although there are people in the media who portray us as in some way the opposition, I don't think we have ever actually disagreed with the formal SAGE. And we do have people who are members of both, actually, or of SPI-M, or SPI-B anyway. And but I think the difference is that we can decide what questions we will answer, and then which obviously SAGE can only answer questions that's asked by ministers. And I think the other big difference that we have is that we actively seek to, maybe not as much as we would like to co-create knowledge, because I think co-creation, co-production knowledge is hugely important, but we really do listen to people on the front line. And I think that's where a lot of the problems have arisen. Because we've had edicts that have come down that are simply unworkable. Now, the Department for Education has probably been one of the worst in all of this. So we're having school teachers and head teachers saying, it just doesn't work that way. We can't do that. And that's where we've had a role. I would say, pay tribute to my colleagues. It has been bloody hard work. We're working 6-7 hours every week in our own time in the evenings, but both with our meetings and preparing the documents. We're getting thousands of our media briefings on a Friday are watched by a very large number of people, and we get very positive feedback. But it is being taken up, particularly in local government. Actually, local government is clearly listening to what we're doing. But it is to fill a bit of a gap. As I say, we're not disagreeing with virtually, I can't think of a single example where we've disagreed with SAGE.
The nature of the advice, it's how it's been used, interpreted, and responded to by the
It's being used in the devolved nations. That clearly is it's clearly being taken up there. It's being taken up in local government and used there. But I don't think that we have any impact whatsoever on central government. And it's also being picked up very much on the backbenches, the all-party parliamentary group in the coronavirus inquiry, and also other politicians contact us frequently.
Una, what's your take on that? I perhaps won't try and pin you down on where you are on that continuum, but give us a hint.
I think, one of the things that I'm really drawn back to is what actually happened. And I think there's such a story to come out yet on what happened between January and April last year. And the precise knowledge that we actually had, for example, about asymptomatic transmission, where that knowledge lay, whether it reached decision makers, how it was presented to them. What was behind the models that we used? Why was it that we had reached a point perhaps of lack of investment in our local public health infrastructure, that we simply were not able to track or even pay attention to the rate at which the virus was coming into the country and spreading? If you go back to the Hygiene report into the swine flu outbreak, and I think a report came out in 2010, there was a clear recommendation there that population level serology was really, really crucial in a pandemic. You need real time information. And we simply didn't have either the insight or the infrastructure to be able to act fast enough. So I'm less drawn to, well, what was the advice in the papers, and more what was the public health infrastructure that enabled the advice to be what it was. And I think there's a really important story that no matter what has happened since, we need to get to the bottom of around those 3 or 4 months. And the only way we'll ever do that is with a public inquiry that's got the powers to get the relevant documents and to hear from everybody so that we can learn the lessons. But I think that is, for me, still the big story about science and the pandemic.
Thank you. Totally. That's great. Sorry, Martin. Last point, if you would.
Well, no, I totally agree. And I strongly suspect from the conversations I have had that, this should not be about blame, but I think there was an awful lot of cognitive biases in here. We had the wrong model. We should have been using the SARS model. We were using a pandemic influenza model. And so many things flowed from that we just had assumptions and things that were taken for granted. And that comes down to this issue of groupthink. It comes down from the need to have a challenge. There were people like Michael Baker in New Zealand, Gabriel Lung in Hong Kong, and others who were saying that Europe, and it's not just the UK, we were actually with the wrong map. And but unfortunately, it just didn't penetrate the decision-making process. And this is not a matter of blame, it's perfectly understandable, but a better understanding of cognitive biases, I think, really would have helped there.
And Harry Rutter makes the, I think, excellent comment that was also an issue, that we have an overly linear approach to highly complex problems.
Exactly.
Which I think is, we need to broaden our understanding of science and have a plurality of approaches to deal with that. So I think with that optimistic thought, and looking forward to a public inquiry, and just a shame I'm not a QC. The major benefits of public inquiries, it has always struck me, has been QCs and people who make paper. But hopefully this one will be more effective than some of the ones that we've seen previously. But I absolutely agree with you. I think that's really important. Thanks to Martin and Una for their excellent thoughts, and to you all for your questions and for joining the session. Tomorrow we're going to explore this a little bit more, where with Jeremy Hunt, Ashley Shah and Alexandra Freeman, with Kenneth Cukier from The Economist, their senior science editor. Next week is the Catalyst for Change. And then we're going to look at centralisation and decentralisation, which I think also Una sort of alluded to as perhaps one of the weak points in UK governance, is that I think it is probably apocryphal, but the view that that England is the most centralised country apart from North Korea. I think elements of France might give us a run for our money, but We certainly may well be an outlier, so we'll be looking to that. We've sent you a link for feedback. Do log in and listen to Kath Checkland at the excellent, it's always been a face-to-face event before now, but the London School of Hygiene and Tropical Medicine, which I'm proud to have an association with, has an annual lecture. This year it's Kath Checkland from Manchester, who's an excellent researcher, talking about face-to-face versus phone and video consultation. So I think Leonore, you posted a web to that. Thanks to you all. It's 11 o'clock and we're done. Thank you.
Thank you. Bye.
Thank you.